Hi, this is Tony with StuffSeniorsNeed.com, and I am coming to you today with a quick video explaining what exactly Medicare Advantage plans are and how they can potentially benefit seniors. So a Medicare Advantage plan is the private version of government-run Medicare. Now, if you go into the government version of Medicare, you have Medicare Part A that covers hospitals. Part B, that covers your doctor's visits and your durable medical equipment. Something like either a wheelchair, walker, oxygen equipment, things like that. You have then a Medicare supplemental insurance plan because Medicare Part B only covers 80% of your costs. You have to pay the other 20% out of pocket. That supplement plan would pay that remaining 20%. And then you also have the option of getting a prescription drug benefit plan, Medicare Part D. What a Medicare Advantage plan does is, in an effort to try and keep costs down, okay, they have combined all of those services into one policy. So rather than dealing with the government, you would be dealing with a private insurance company that would handle your Medicare Part A, Part B, your supplemental plan, and your prescription drug benefit. Now, I'm not going to get into the debate of which is better, mainly because there's a lot of politics as to whether or not one saves over the other. That's not the purpose of this. What I want to do is just give you the ins and outs of a Medicare Advantage plan and show you how potentially this option could be good for you. So I want to take a look at the situation. When you turn 65, that's when the Medicare open enrollment period begins for you. And you have to start making Medicare decisions. And you need to decide whether to go into the government-run plan, which is, like I said, Part A, Part B, Part D, or you get these benefits from a private insurance company. Now, many insurance companies will offer Medicare Advantage plans. I've only listed a few here, okay? Humana, Aetna, AARP endorses one through United Healthcare, Blue Cross, and Blue Shield. What you would need to do is contact each of them individually and find out the pros and cons of their individual plans. Okay? What you're going to find, though, is that they basically come down to two types of plans, either an HMO or a PPO plan. The difference is with the HMO plan, you have to stick more to their network of doctors. With the PPO plan, you have a little bit more freedom in terms of choosing your own doctor. So as a result, the PPO plans will always cost more than the HMO plans, but ultimately that's a personal choice. Here are some of the reasons why people do make the decision to go with a Medicare Advantage plan. First of all, they're only paying one premium, okay? And by that I mean you're not paying your Part B, you're not paying for a Medicare supplement monthly, you're not paying for a prescription drug benefit. All of those are rolled into one payment. So it definitely makes accounting easier. Another reason, when you're in the government version of Medicare, okay, you go to the doctor, Medicare Part B will pay 80% of the bill. You have to pay the remaining 20%, and that's either out of your pocket or through a Medicare supplement. With the Advantage plan, the insurance company pays 100% of the costs. Okay? The big reason, though, are the perks. There are a lot of perks that companies give to give you an inducement to join their plan. Now, they vary from company to company, so you need to check them out. Okay? But I mean, these are some of the things that I have heard. Anything from aspirin, free Band-Aids, blood pressure and glucose meters, thermometers, gym memberships, prescription eyeglasses. I even heard of one that actually gave free hearing aids. So you're going to need to take a look into the pros and cons of each plan. I will tell you this. My mother had a Medicare Advantage plan and it worked very well for her, right up until the point when she took her heart attack and needed to go into the nursing home. It paid all her medical bills, when she was in the hospital. But when she went to the custodial care, at that point in time, we had to switch from the Medicare Advantage plan to Medicaid. You would have to do that with government-run Medicare as well, because they won't pick up long-term custodial care either. But the one thing that the nursing home told me is that the Medicare Advantage plans do not work well. They don't work well with nursing homes. So that's just something to keep in mind. I would definitely say that this is something for you to consider if you are a somewhat healthy senior, especially if you are into wellness programs and preventive programs in order to keep your health up. And there is one update that I have to add for 2013. Starting in 2013, okay, you're going to be able to switch Medicare plans outside of the standard enrollment period. That enrollment period is typically from mid-October to early December, when you have the right to, make your changes in your Medicare plan. So long as it's a 5-star plan you're switching to, you can switch at any time of the year. And so that's something new that's been added for Medicare Advantage plans to give you a little bit extra flexibility. So I hope this helped. This is Tony with Stuff Seniors Need, and I will see you next time. Take care.